This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is Medtalk, your weekly on-air health consultation here on the Solar News Channel.
Aside from eating healthy food and exercise, getting enough sleep is essential for a healthy body, soul, and mind. Sleep boosts your mood in the morning, recharges your brain, and repairs your cells. In contrast, sleep deprivation, oversleeping, snoring, and difficulty in breathing while asleep could pose as an underlying health condition. With the presence of these symptoms, one may be suffering from a sleep disorder. One of the most common sleep disorders is insomnia. It is one of the major causes of sleep deprivation and is characterized by difficulty in sleeping, despite being tired, waking up in the middle of the night, and having a difficult time in falling asleep again. People often think that snoring is just a normal part of one's sleeping habit. But this is one of the common signs of a serious sleep disorder called sleep apnea. People with sleep apnea experience interrupted breathing while sleeping without them knowing it. A blockage of the airflow through the mouth and nose, thus causing the individual to snore. According to statistics, 50% of all apnea cases are diagnosed among individuals ages 40 and above. It is also observed more in men compared to women. In contrast to insomnia, narcolepsy is a neurological disorder that causes excessive sleepiness and frequent daytime sleep attacks. Studies show that narcoleptic symptoms appear between the ages of 15 to 30. The most common symptom is a strong urge to fall asleep often, followed by a short nap or sleep attack. Sleep attacks may be experienced at any time of the day, even in the middle of normal activities such as driving, eating, or even talking to someone. Monitoring your sleeping habits will help you take better care of your health.
Snoring may be normal if it occurs once in a while. However, loud and regular nightly snoring should be a cause for concern, and Pinoys often take this for granted. In tonight's episode, we will talk about sleep disorders, how do we know if we are already suffering from a sleep disorder, and how can we avoid it? Joining us tonight is Dr. Jonalyn Chris Ang, sleep specialist from the Chinese General Hospital. She's also a pediatric neurologist and sleep specialist from the Cardinal Santos Medical Center. Also with us is Dr. Gil Vicente, founding member of the International Sleep Surgery Society and Asian Sleep Society. He's also the chief of the rhinology section of the Jose Reyes Memorial Medical Center and the St. Luke's Medical Center. You can participate in the discussion by calling our hotline, following us on Twitter, and by email. Now, let's start our discussion. Welcome to the show, doctors.
Hi, hello.
Hi. How important is sleep?
Yeah, very important because basically it can have some side effects. It gradually would lead to, okay, so what's important is it can lead to hypertension, stroke, diabetes, depression, and among the male population, impotence. Okay? So that's, I think, very important. And also in the social side of it, snoring may be an embarrassment to probably also a disturbance to your wife and to the community.
Not only maybe to the wife, maybe if you're inside the plane or in a car or at work, di ba? So that's a disturbance that the lack of sleep does cause. Why is it very important for us to monitor our sleep or to be able to get a good night's rest?
Sleep is very important because we are all a 24-hour individual, and babies and children are not spared from it. So we should have a good quality and good quantity of sleep because it rejuvenates the cells in our bodies, and it also affects our mood. If we do not sleep well, then we get irritable in the morning. we are abnormally sleepy during the morning.
It improves our performance in school and not as well as in work. So if we do have a good night's sleep, then we probably would be performing well, be very sociable. Okay?
So yung iba, lack of sleep only maybe because they're stressed or maybe because you know, there's something that happened to them during the day na hindi nila na-compensate sa tulog nila.
Yeah.
But when does it become a disorder?
So it becomes a disorder when we see that there is some problem with the sleeping pattern. The sleeping pattern here becomes you actually stop snoring for a while, and particularly for about 10 seconds. Okay, so that's we call the apnea spell. There's also what we call the hypoxia spell, which is actually the decrease in oxygen when you sleep during sleep. So apnea means stoppage of sleep. Hypoxia is the diminution of the oxygen which comes into your body during sleep. So once there is an interplay of the apnea or stoppage of breathing, then this could be dangerous to you. It's likely. And then what I told you before, the complications or the side effects would definitely set in slowly.
Okay. And you mentioned snoring.
And
when
snoring.
Is there certain type of snore that when you hear it, it's healthy? Or is there a certain type of sound or noise that snoring makes that you have to be alarmed already? Dr.
Yes.
Ang?
Not all snoring, it doesn't mean that when you snore, you already have a sleep disorder or a sleep apnea. But there are some signs. Actually, we can ask for the wife or someone who hears the bedtime snoring. We can ask them to imitate the actual snoring itself, because from there, we will know if he or she is suffering from sleep apnea. Like if they are gasping for air, such as when you snore, you do like
I was about to do that. So I'll go.
Yes,
Like
that's
that.
it.
Yes.
So,
this is what we call witnessed apnea. Witness, somebody witnesses you. Kasi tulog ka, so
you
hindi
don't
mo alam
know.
kung nag-snore ka ba. So usually sabihin, hindi ko alam. Pero you ask the wife, you ask the neighbors, minsan hanggang sa kabilang, ano yun, ha?
Di ba joke nga yan na parang kung may concert na naman, you know, you can hear the person snoring kasi ganun siya kalakas or ganun yung the levels. May levels of snoring. So, kailangan ba na dalhin ka agad yun sa doctor? Is that a cause for alarm for one to be brought to a sleep specialist?
Particularly if there is the apnea spell.
Yes.
Pag tumigil ang paghinga, tapos yung nagigising, that's probably alarming. No? And I think it should be brought to attention by a doctor, okay, or somebody else who has some concern or interested in the problem.
So we mentioned the kind or the noise that one makes pagka may sleep apnea na. Ano pa yung ibang signs and symptoms to watch out for?
There are usually there is abnormal sweating at night, and then you have abnormal positioning at night, like because you tend to compensate for the lack of air while you're sleeping. And then there are also daytime symptoms, like in adults, mainly daytime sleepiness. In children, it's more of, they imitate the symptoms of ADHD actually. Hyperactivity, inattentiveness.
Okay, doctors, we will go to the signs and symptoms. I'll go back to that again, but now we have to go to our Twitter account because Emmy Pangilinan asks, I'm 19 and I sleepwalk and I sleep talk. I really want to stop it, but I don't know how. It has gotten to the point where I once left my house and went to knock on my neighbor's door. I got really scared, so I decided to share a room with my sister. And she tells me that I sleep talk almost every day. What can I do to stop it? Oh, she's 19.
So there are also abnormal events during sleep, and we call it parasomnias. So sleep talking and sleepwalking, they are under the categories of parasomnias, also sleep disorders. Normally, we don't give them medications for this kind of disorders, but we just prevent injury. Because once you walk and comes out of the house,
and you knock on someone's door,
so it puts you in danger because you don't know what you're doing. You're actually sleeping. So you just need to put your room, if there's a lock, you put it on the upper that you cannot reach. So we are just merely preventing, and we need to emphasize good sleep habits because it will also prevent these events.
what are good sleep habits?
I think what's important is to have a sleep 7 to 8 hours a day. I think studies have shown that this is very important. No? You may have the afternoon nap, the power nap.
Yes.
And I think it gives me also, for me, it's very important for me to have that nap. You can have 20 minutes or so of power nap, and then that would give me a additional power in the afternoon towards nighttime.
And then we should avoid watching television at night, actually.
No television in your bedroom.
Yeah, in your bedroom. You
Yes.
you just use your bedroom for sleep.
Use your bedroom for sleep. Let's see if Tommy De Los Reyes uses his bedroom for sleep. Hi, Tommy.
Hello?
Hi, Tommy. You have a question for our doctors?
I'd like to consult something.
Yes, please. Go ahead.
Doc, I started noticing a couple of years ago that I would fall asleep for a second while driving. Then finally I had to give up on driving and had to hire a driver. I don't believe I have sleep apnea as well, because I sleep well and don't snore and get full night's sleep. Is there a medical reason for this?
Okay, thanks, Tommy. Doctors?
Okay, so I think Tommy has abnormal sleepiness. It's abnormal daytime sleepiness, and it is actually very dangerous. He stopped driving to prevent himself from incurring accidents. So I think he should be evaluated, especially for obstructive sleep apnea and for narcolepsy, to rule out this kind of disorders.
Tom might be denying it, but then I think meron tayo tinatawag ng witness apnea. So you ask our neighbor, you ask your friend, you ask your wife especially, or whoever sleeps with you or near you during your sleep. So much so that he probably can tell you more how you sleep, whether you snore or not. I think that's very important.
Yes.
And important that he's aware of it. He has gotten a driver to drive for him. I hope he still doesn't sleep in the afternoon, that he's still aware.
At least
even with the
makakatulog na
press.
siya ngayon safely. Kasi tulog naman siya, hindi naman siya nagdadrive.
Nagdadrive.
And
Pero
I think this is the most common type of accident to have. No? So it's because of the sleepiness by the driver.
and during the day, when you're
Yes,
not supposed to be asleep, when you're supposed to be very alert and awake. Yes. Doctors, when we come back, we will be joined by Cleve Yu, who is diagnosed with sleep apnea. Medtalk will be right back.
Daytime naps improve memory and cut the risk of heart disease. This is Cleve Yu. Being overweight and hypertensive, Cleve experiences interrupted breathing while sleeping.
I was very inactive, and I would be falling asleep while I'm trying to drive. I'd lay on the couch most of the time, so it's not very active.
Bothered by this fact, Cleve decided to undergo a sleep test called polysomnography, a diagnostic sleep test that supervises a patient's body function while sleeping. It monitors the brain's electrical activity, muscle movement, and airflow. The test revealed Cleve has sleep apnea and was advised to go through UPPP surgery, a surgical procedure used to remove tissue in the throat. Cleve has been using a continuous positive airway pressure or CPAP for 5 years now, a machine that helps him breathe easily while sleeping. The EEG or electroencephalogram. This records the electrical activity across a patient's brain. This is used to determine the stage of sleep a patient is in during any given period of the night. Electrooculogram or EOG records movement of the eye during sleep and serves to help determine sleep stages. EMG or electromyogram, on the other hand, examines one's wake period, an arousal or a spastic movement while a patient is sleeping. ECG or electrocardiogram, this records the patient's heart rate and rhythm and aids to alert the physician for a possible emergency situation during the test. A thermocouple or thermistor is an airflow sensor. This is secured under the patient's nose to examine the amount of air moving in and out of the airways and sends a signal to the physiological recorder. The piezo crystal sensor is used to measure the chest and abdominal movements of the patient. This, alongside the airflow sensor, is utilized to categorize the type of apnea a patient may have. Today, Cleve maintains his weight by eating right, engaging in sports activities such as biking, golf, and tennis, and make sure he keeps his regular sleep routine.
We're back here on Medtalk. We're still talking about sleep disorders, and joining us is Cleve Yu, who has been diagnosed with sleep apnea. Hi, Cleve.
Hello.
How are you?
I'm good.
How did slept well?
Well, yeah, I've been sleeping well because I'm under a CPAP therapy, so it's been a life changer for me.
Mm-hmm. CPAP meaning?
It stands for continuous positive airway pressure. Mm-hmm. So it's essentially a machine that you sleep with at night that blows air into while you're sleeping.
Okay. How was your sleep pattern like, or how was sleep like for you before this machine?
Well, it got so bad that in 2004, I believe, I literally have to change careers. I was driving about an hour and a half from my house to work. And you know it's bad when you have to stop in the middle to kind of take a little quick nap just to go home. So, and my wife was telling me that I do stop breathing when I'm sleeping. So, I had myself diagnosed, I had myself tested, and went through all forms of therapy.
Including surgery?
I actually had surgery first. I'm a type A personality, so I want to get the problem solved, taken care of, right? And so I went to the doctor. I said, just cut it off. And so they did that. It helped a little bit, but my body kind of readjusted. And then I'm back to having the apnea again. And finally, I settled down with CPAP as the therapy that works for me.
Let me go back to what you said. You had the doctor cut it off. What exactly did they cut off?
I can't even pronounce it, but it's in short, it's called a UPPP.
Uvulo.
So I'm going to have the doctor
The uvula
translate
is the one
that.
is going down there when you open your mouth. That's the uvula. Palato is the palat, ngala-ngala. Okay, and the plasty or the pharyngo is the pharynx, and then the plasty is the plastic surgery itself. Okay, so it's a kind of plastic surgery because you do something inside your throat. Okay, so I wanted to ask Cleve, that's the only thing what was done.
Yes,
yeah.
yes.
Because there are three aspects which we should look into. So about 10% is caused by nasal problem, 40% by your palate, okay, and then another 40% by your tongue. So the tongue should always be addressed during the operation as well, and to be recognized fairly well by some examinations which we can do to really evaluate which one dominates. And so was this addressed during the operation?
You know, that's a good question because it happened so long ago. It's 2004, so it's about
9 years.
Yeah, about 9 years. I believe that they told me to have my sinus taken care of. The problem is I actually didn't have the time, and I thought that taking care of the UPP would solve everything, but it didn't. So it's partly my mistake. So I'm guilty of that.
So how do you feel now? With how long has the machine been with you?
I've had it since maybe 2006, because 2004 to 2006 I went through different forms of therapy. So I tried the UPP. I also tried the dental appliance, wherein they try to move your lower jaw forward to open up your airway. It's when I went to CPAP therapy that things kind of worked for me. And it's important to emphasize that there's different therapies for different people. But the important thing is you have to get tested, right? So once you know what you have, then you could embark on a journey of how to fix it. And that's what I did.
And thank you for sharing your story with us. But I'll go back to you in a bit. We just have a caller on the line. We have Rogeline Nepomuceno. Hi, Rogeline.
Hi, Angel. Hi, doctors. I've been having these weird electric shock sensations right when I'm about to fall asleep. It's hard to describe, but it's like my brain all of a sudden sends an electric current throughout my body. It scares me so much. What is this? Is there a treatment for this? Thank you.
Thank you too. Electric shock through her body as she's about to sleep. So I have a mental picture of what's going on.
So these are parasomnias, like the sleepwalking and sleep talking. And usually she needs a seizure disorder should be ruled out in this case, because she can feel the electric sensation. Normally it's on the legs, because we have also the so-called restless leg syndrome, when we feel a pricking sensation on the legs when we are not moving, and it is more prominent at night. So in her case, all the body is involved, so a seizure disorder should be ruled out.
Okay, so she should seek the help of a sleep specialist already?
Specialist
and
neurologist.
Neurologist, okay. So, Rogeline, I hope you heard that. Please consult a sleep specialist and a neurologist. Consult our doctors. All right, from our Facebook page, Annette Rosario asks, I have not been able to sleep for more than 5 hours a night for a few years now. Is this healthy? What can I do to get started on sleeping on normal hours, like 8 hours? Because as you mentioned, 8 hours is the best.
Yeah. Dr. Ang already mentioned that sleeping in regular pattern. So if you're sleeping at about 10 o'clock, so start sleeping at that time, and then till you wake up at 6 o'clock. There are ways of putting you to sleep, like exercising, drinking hot water, hot coffee, not coffee.
Decaf maybe.
Milk.
Hot milk.
Even decaffeinated doesn't work. It should not be taken. Okay. Or there are actually, if you look into the internet, there are food which puts you to sleep, like oatmeal, walnut. Okay. So that would be something which have things which will be helpful in putting you to sleep.
We also have an important question from our Twitter account. Vincent Villavicencio asks, does sleeping after eating, nako, this is a common question, does sleeping after eating cause a lot of nightmares? Or sinasabi nila, pag natulog ka at busog ka, babangungutin ka.
Yeah.
Is there any truth to this?
We've seen a lot of people having this kind of stories. Kumain ka, galing piyesta, as much as possible. Don't make yourself full before a night's sleep, no? So because there would be an increase of the hydrogen, or of the protein as well as your carbohydrate, and this would stimulate you, and this probably put you into something which would put you in a situation which would not good, and it will probably stimulate your brain to have some kind of a dangerous pattern. Okay, so as much as possible, it's correct that not to indulge yourself, be gluttonous when you don't go to fiestas the night before, or go to drinking as well, drinking, and also in smorgasbord or eat all you can thing.
Or mga buffet. Maybe you can stop the buffet at around 8, maybe. Start at 6 and stop at around 8.
Yeah, 2 hours prior to bedtime.
Okay, so 2 hours prior to bedtime. Well, everyone's listening. 2 hours prior to bedtime. That's the time you cut it.
Yeah.
And there's another day to enjoy and indulge, right? From our Facebook page, Jonas Gorin asks, I think I have insomnia. Is this safe, or is it safe to take sleeping pills for his insomnia? Ako, common question din yan.
Yeah.
Insomnia. And how do you know kung it really is insomnia? Is there a pattern that one
Yes,
must
there are many
look out
kinds
for?
of there are many kinds of insomnia, and I think, Jonas, you should consult a sleep specialist before taking sleeping pills, because that's dangerous. Because if you have sleep apnea and you take these sleeping pills, then you put yourself in danger.
Do not self-medicate.
Yes.
Do not self-medicate.
Just because it works for a friend probably, or a relative, doesn't hold true that it's going to work for you.
Yes.
Especially the antidepressants. So that would be very dangerous. So consult first your doctor before doing that.
Baka instead of being able to sleep well, hindi ka palalo makatulog because
Yes.
you know.
Or you sleep forever.
And rest in peace.
But Cleve, any other tips you would like to share with our viewers from the experience that you've had?
I think the best tip I could tell people is to just get tested, and if you have a problem, take it seriously. Try to fix it, because it's life-threatening in the overall scheme of things, and it will change most people's lives.
Like it has changed yours.
Exactly.
And thank you for changing our lives with your story. Thank
Thank
you
you.
very much, Cleve. I would also like to thank our guests for helping us understand sleep disorder. Thank you so much, Dr. Hill M. Vicente and Dr. Jonalyn Chris T. Ang, for joining us. Thank you so much, doctors. I know I will sleep well tonight with all the information that you've passed on to me and our viewers. Thank you once again. See you again next Tuesday on Medtalk, 10 p.m. on your scheduled on-air consultation here on the Solar News Channel. This has been Angel Jacob.